Florida.
Thank you, Mr. Chair. This past month, the FDA reported 15 food and drug recalls. That's about a recall every 48 hours. It was even higher in January and February. And many of these recalls were very serious. They were for things like food allergen, cross-contamination, cancer-causing arsenic, and lead, which can cause severe learning disabilities in children and miscarriages in adults. The past month also saw pet foods contaminated with bird flu. While these recalls save lives when folks are alerted in time, they also can cost working families time and money to replace recalled food. You know, this year tuna was recalled. That's about $3 per can down the drain. Prepared salads were recalled, another $5 each. Frozen dinners were recalled, $4, $5, $6 a serving. These numbers might seem small, but folks managing a family budget know how grocery costs add up and what a waste it is to throw out food. Dr. Kessler, how does the work of the FDA's labs and inspectors help catch problems before bad food hits the grocery stores?
The laboratories are absolutely essential at that detection. 4 FDA laboratories, 2 food labs, 2 medical product labs have been shut. Those recalls that are absolutely essential, the people who communicate about those recalls, the communication shops, have been gutted.
Trump and Musk claimed that the mass layoffs at the VA and the Social Security Administration wouldn't impact the services, but we're seeing that's not true. Services for veterans, seniors across the entire country are getting worse. Wait times are at all-time highs. Now, Trump and RFK Jr. are claiming that the mass layoffs at the FDA won't negatively impact food inspections. Dr. Kessler, how could mass layoffs at the FDA impact food inspections?
It will have a real and demonstrable effect. Yes, the inspectors have not been touched as of today, from what I can tell, but all their support, all their infrastructure is gone. So all those inspectors can't get the supplies they need to inspect. They have to do their own travel. Their travel cards are not working. I'm not sure what the strategy is.
And what does this mean for Americans' vulnerability to serious foodborne illnesses?
I fear that we are less safe today. You know, I wish that were not the case, but you can't take thousands of people out of the FDA and not understand that you're putting the American people at risk.
You know, I'm one of the 33 million Americans living with potentially life-threatening food allergies. I've almost died, actually, because of an anaphylactic attack. Dr. Kessler, how could cuts to the FDA impact day-to-day safety of folks like me who live with serious food allergies?
The people who communicate, who share that information, who share that risk information, the people who write the policies that give the industry the guidance of what to put on the labels, they're not there anymore.
Say we're lucky and these mass layoffs have no impact at the FDA with undercovering potential foodborne disease outbreaks before they spread. How will cuts to FDA staff impact the people who are still there, their ability to alert the public to the threat of allergen cross-contamination or an E. coli outbreak?
I think the effect of these cuts, not only on the people who've left, and I'm hearing repeat stories, I mean, about, how these were done, when they were done, right? I mean, the real thoughtless, careless, almost mean aspects of how this information was communicated. But people are getting up, people who have enormous expertise, decades of expertise on those kind of questions, on those allergies, they're not staying at the energy. And recruitment, getting the best and the brightest, something that we all believed in, that we dedicated our careers to be able to go into these agencies and provide that kind of public service. What signal is that sending? We're losing generations of future public servants, and that concerns me greatly.
Thank you.